Thank you very much. It's great to be here with so many friends. It's an honor to be here with such a tremendously distinguished panel. I always love talking about children's health. My first event in the White House, I went to work for Hillary Clinton over 10 years ago in the Domestic Policy Council at the White House, and my first event with her was an event at Children's Hospital up the street, and we were focused on implementation around children's health insurance program because Hillary was very worried that the program structure wouldn't get kids covered. We wouldn't have enough focus on ensuring that the states were really pulling down the dollars. And so there was a lot of worry about how we could really ensure that with public-private partnerships, we were actually bringing those kids in. And CHIP has been and was one of the great successes of the Clinton administration because we were able to actually cover millions of children. And I know I have worked with a lot of people in this room for years to ensure that we had a CHIP expansion. And so it's been an amazing victory, really, that just in the first few months of the Obama administration, we were able to ensure that 4 million additional children would be covered. And that is an exciting victory for all of us and a tribute to the people in this room. So I want to say thank you to everyone here. And it's people on both sides of this panel that worked tremendously hard to get that victory done. And so I want to take a breath and just say again that there are children today and in the years to come who will have coverage because of the leadership of the Congress and the President. And so that is something that we should savor, but we should not rest as because I think what everyone is saying on this panel is that a single uninsured child is still a tragedy in our country. And I know that was a significant issue for the President as he campaigned and my former boss to ensure that we were covering every child as we go forward in our broad healthcare reform efforts. And I think that is a critically important issue, and I applaud what these organizations are saying around ensuring that we're covering children with real quality benefits, that there's real access, and health insurance is actually affordable to families. We know that children, parents who aren't covered, don't cover their children. And so I think part of what we need to do is ensure that there's urgency around the broad health reform effort. We need to cover every child in America, but we need to also cover every American. And I hope that all of us focus on ensuring that as we go forward, there's a real urgency to passing healthcare reform this year. And I don't have to say that to everyone in this room because I know most people are really working very hard on that. We applaud the tremendous work happening in committees as we speak and both sides of the Hill. I know people are working very hard to ensure that we have a system of covering every American, lowering costs and improving quality. And as we do that, it's critically important that we remember what the real benefits we are having for kids. We are talking about the most vulnerable members of our society and ensuring that we're not just saying we're covering everyone, we're covering them in a meaningful way. And that is a significant issue that we all have to work on as we go forward. But I think we are hopefully months, not years away from a day that we cover every one of those children, but we cover their parents too. We cover every neighbor, we cover every person we really have reached the promised land of ensuring that we don't have millions of people uncovered in our country. And it's with the leadership of people in this room and the Congress and again, the President and the organizations here that we'll be able to do that. Because I think it's important for us to see children as part of the broader framework of health reform in general. So with that, thank you very much. It's great to be here. Thank you.